back. The topic today is 10 interesting facts about appendicitis or appendix. So in the previous videos, we all know what is appendicitis, what is the appendix, where it's situated, what are the causes, treatment, all these things about appendicitis. Now here we see only the salient 10 facts. Okay, and we all know it's an organ, the worm-like organ, and the junction of small intestine, large intestine. It attaches to the large intestine. So in the right lower quadrant of the abdomen. Okay, but those days we used to think it's a vestigial organ without any purpose or without any function. But now appendix is considered as an organ, like any other organ, like liver, kidney. It's like an appendix is also an organ with a purpose. What is that? It improves, or it's a very crucial. It plays a very crucial role in our immunity. How? By harboring good bacteria, the gut flora. It has a good, beneficial gut flora, which directly, impacts our immunity. So it's an organ with a purpose. Immunity is the main part. Okay, number one. Number two, and most of the time we always think appendix is occurs in only the young people, usually from 9 years to 27 years to 30 years. But it can occur at any age, from infant to 90 years, 100 years, irrespective of the male, female, irrespective of everything. It can occur at any age, from infant to very old age. And one of the main complaints or the symptom of appendicitis is pain. This is a misleading one. The other fact is pain. Pain is misleading. Most of the time, it can even occur without pain. Only the breathlessness, or maybe breathing difficulty, or bloated feet, all these things without pain. Number one, the pain usually is in the right lower part of the abdomen, but the pain can be in the epigastrium, this area. It will be around the navel region or the umbilical region. You can go to the right lower part. But other organs like your right kidney, ureter, right ureter, or even the ovaries, right ovaries, they can also mimic the same kind of pain. Sometimes appendix, the pain will be in the back. It all depends upon the position of the appendix. That's simply the pain, misleading, because the position of the appendix is changing. Suppose the position is the backwards, the pain is more on the back. Or if it's in the pelvic, it can be more on the lower, the rectal region, it can give pain. So pain is always misleading in appendicitis. And the next fact is, people think it's acute onset of pain is in appendicitis, the pain is acute onset. No. Usually it comes, gradually. Usually they would have had at least 2 or 3 episodes of appendicitis, would have been treated by a local doctor with simple antibiotics or painkillers. Since they are healthy first time, all these symptoms would have been masked. But all of a sudden, maybe after few episodes, the pain becomes very severe. So the onset of pain is not acute or sudden. It is usually there is a history. We call it, there is a history. Probably people fail to appreciate the history, but there is a history. And the other fact is, most of the time we think the appendix is attached to the large intestine. So the base of the appendix, when it gets blocked, or the opening into the large intestine get blocked, it gets appendicitis. No, it can happen for so many other reasons, like stool impaction. The motion gets into like a stone-like thing and gets into there and cause appendicitis. Infection can cause your loss of immunity, or these things can be aggravated by the outside food, or whenever the immunity goes down, the infection can come. So it's need not be always the blockage of the appendix base. The other thing is, fact is, acute appendicitis, if it's diagnosed, it's an emergency. It's a medical emergency. You cannot neglect it. Either you get admitted with conservative treatment, or you get admitted with surgery, mostly surgery. That is decided by your clinician. So the people think, okay, I have appendicitis, I can be treated like, just like that. No, it has to be given importance, and it needs IV antibiotics and followed by surgery, which is decided by the surgeon, especially the surgeon, and according to your examination and your presentation. Okay, and the other fact, most of the parents, they always ask, okay, my first child had this appendicitis, whether my second child will have, can I prevent the disease? My father had, so will I get that appendix? Can I prevent that? No, nothing can be done to prevent the appendicitis. Most of the people think, okay, eating this kind of food or avoiding this food can prevent appendix. No, it cannot be prevented. So, but you don't have to worry about those things. And very importantly, after examining the other factors, when the doctor examines and he suspects appendicitis, he may ask for some tests, especially radiological or the scan. The imagings are always confusing. They are not absolute. They are not, they won't say, okay, you have appendicitis. You cannot. Most of the time, 30% of the time, only 30% of the time, CT scan or these things can diagnose the appendicitis. It's only the clinical examination, history, clinical examination, your presentation, and doctor's clinical experience and other supportive, investigations, supportive findings. They can see in CT scan. It may not show that you have appendicitis, but it can indirectly show you have lymph nodes. The mesenteric lymph node. They say right here, fossa. There are a lot of lymph nodes. We all know. So that could be an indirect sign, especially in children. The lymph nodes can indirectly tell us that they have an appendicitis. The other fact is, it is the most common done surgery throughout the world. Every day is so common. The most common surgical procedure in the world is appendicitis. The appendix removal surgery. It's all done by mostly nowadays the only laparoscopic method. So you don't have to worry. The risk or the complications are all almost like with any other surgery, and but most of the time it happens in the children. So the parents will be more, they'll be a little worried. So the parents don't have to worry because the most common surgery, the least complication and the side effects, whatever it is. So, but the treatment it's a surgery. So the acute appendicitis, when it's diagnosed, it needs most of the time surgical removal. Okay. And the other fact, most of the people ask us is whether I will get back again, recurrence, whether my appendix will regrow. They always ask these questions. The reason being, those days the appendix is like organ. So when we cut by open surgical method, the conventional method, when we cut, there is a small tissue of appendix can be left behind, because we don't want to unnecessarily touch the large intestine. So small, maybe 1 millimeter of appendicular tissue would have been left behind. That very, 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 very rarely, I have not yet seen one single case in my lifetime can get into infection. So that's called stump. The left behind 1 millimeter is called stump. The stump can get into infection that can cause stump appendicitis. Okay, so people think, okay, I got the second time this thing, they think, okay, it's about regrown or I have a recurrence. No, most of the time, if you have the same kind of pain with the same side, always look for other reasons like pain from the ovary, pain from the fallopian tube, uterus, and very importantly, right ureter, stones and everything, and of course other large intestine areas and all. So once appendix has been surgically removed, if there is a pain coming back again, we should look for other reasons. So these are the important salient facts about appendicitis. Thank you.